fair. Okay, so for the next issue in the umbilicus, in the placenta, right? This is what the umbilical vein obstruction. Of course, the placenta going to fix into the baby is what umbilicus, right? So just that part is having, umbilical vein, umbilical arteries. They are very important in transporting oxygen, transporting nutrients, transporting carbon monoxide, and all of that, right? So what will happen if there's an obstruction? All right. So if you know the functions of the umbilical vein, you could now infer if there's an obstruction. These are the possible complications, because of course the functions will be cut off. You understand? So umbilical vein, this is the umbilical vein, this is the umbilical artery. You understand? So we're just saying there's an obstruction in the vein. What will happen? All right. So it's a rare, but it's a very serious condition. It will affect the way things are circulating to the baby and things are circulating out of the baby. All right. So function of the umbilical vein. First of all, before you talk about the complications, it's good you know the normal function so that you know the abnormal properly. So this one carries oxygen. Unlike in the grown-ups that the veins carry deoxygenated blood, in the babies, the veins carry what? Oxygenated blood, right? So the veins are also nutrient rich, so they are carrying from the mother to the baby. So what will happen here? So a blockage or compression may impair the way blood is flowing to the fetus. So there's reduced oxygen reaching the baby, there's reduced nutrients reaching the baby. So causes, it could be from issues like umbilical knots, torsions, enlargements, tumors like sarcococcygeal teratoma, thrombosis. It could be that the blood clot abnormally in the vein, external compressions from uterine anomalies or masses, right? So clinical consequences: fetal hypoxia, so reduced oxygen delivery can lead to distress or organ damage, right? Growth restrictions, fetal hydros, there's accumulation of fluid in the babies. Okay, stillbirth, in extreme cases, complete obstructions may be fatal. So diagnosis is all those perinatal ultrasound. So you want to dictate it before the baby actually grows up. Doppler studies, the MRIs. Okay. So management is you want to monitor. You are monitoring the baby on ultrasound and Doppler assessment. Early delivery. Okay, because the issue causing this is what? Part of it is pregnancy, right? So you want to deliver the baby early. Then supportive care, like what? To resuscitate the baby, because the baby might be in shock already. All right. The intensive care, put them in intensive care units. That's after delivery.